Hi, I'm Julie,
I'm Hannah.
and today we're going to be talking about soft tissue injuries. Okay. Okay, so a soft tissue injury is just defined as an injury to the layers of the skin, fat, or muscle. And so soft tissue injuries can be very mild, so just like a paper cut or a scrape, but they could also be really severe or life-threatening, for example, like a third-degree burn or like a gunshot wound, things like that. So it really ranges in severity. And we're going to be talking about how to deal with both mild and life threatening injuries. And some risks to soft tissue wounds would be, of course, tissue damage, but there's also risk of severe bleeding, especially with closed wounds, which we'll talk about more. And then infection is a really big part, especially if it's an open wound. So yeah, kind of like I said before, soft tissue injuries have a really big range. I included some examples below. It might be helpful if you can go through all of them and try to see if you can figure out if they would be a minor injury or a life-threatening injury, and think about what you might do in this situation. And we're going to be talking about each of them individually. Okay, I said the first type is a closed, and that's skin is broken. Common closed wound that we might hear about or be familiar with is a bruise, which is pretty simple. But closed wounds can actually be really dangerous and complicated because we can't actually see the injury or the full extent of the injury a lot of times. So somebody could be in an accident and have really severe trauma to their internal organs, but we wouldn't be able to see that from the outside. So that's why it's really important that we keep an eye out for certain symptoms and signs of internal bleeding, which I'm going to talk about right now. But don't underestimate closed wounds because in a lot of cases they can be really dangerous. So for a more mild closed wound, like a bruise, one thing you can do is just apply ice to the injured area. Do it in 20-minute periods, but if the person can't handle that, then 10-minute periods also works. You can elevate the injury if you can, but if it causes more pain, then that might not be best because you might make the injury worse. So there's this acronym RICE. That's an easy way to remember. Rest, ice, compress, and elevate. So if you want to know what to do, you can just remember RICE. And if it's a more severe injury, like I said, there is a potential for heavy internal bleeding. So you want to be looking out for signs that the person may be experiencing that and call 911 right away if you see them. So some examples would be a rapid weak pulse, an altered mental state, or cool bluish pale skin, all of which are signs of shock, which is very serious. Or vomiting blood or coughing up blood or anything that might tell you that they're having some kind of internal bleeding that you might not be able to see. And then the second type of soft tissue wound is an open wound, and that's when the skin is broken. So there are four major types of open wounds. There's abrasions, which we know as scrapes, lacerations, cuts, avulsions, which tend to be a lot more serious. That's when the skin or tissue is torn away. So like an amputated like finger, for example, would be an avulsion. That's usually like a pretty serious situation. And punctures, including gunshot wounds. So there's a really high risk of infection for open wounds, which is why we're going to talk about later. It's really important to make sure that the wound is cleaned if possible. And as always, call 911 if you suspect the wound is really severe.